This is Lab Medicine Rounds, a curated podcast for physicians, laboratory professionals, and students. I'm your host, Justin Kreuter, a transfusion medicine pathologist and assistant professor of laboratory medicine and pathology at Mayo Clinic. Recently, I participated in a hackathon with a group of medical students from Mayo Clinic's Alex School of Medicine here in Rochester, Minnesota, focused on global surgery. And it gave me a really kind of interesting insight into thinking about how we're teaching our learners to think about healthcare systems. And so today we actually have four medical students with us to talk about this topic. So I'll introduce them in sequence for all of our audio listeners to kind of hear their voice. So we'll start off with Matt Gish is a second year medical student here at Mayo Clinic.
Hey everybody, thanks for having me, Dr. Kreuter.
Absolutely. And Audrey Banks is a first year medical student here at Mayo Clinic.
Yep. Hello, everybody. Happy to be here.
And we've got Youssef Khalil is a second year medical student here at Mayo.
Hi, everyone. Thanks for having me.
And finally, we've got Richard Betancourt here as a second year medical student at Mayo.
Hi, everyone. Happy to be here.
All right, so let's kind of kick this off. Maybe to start off, maybe Matt, you can get us kind of started with this question of why is it important for a physician to think about healthcare systems?
Yeah, this is a question that I think we need to continuously wrestle with in medical school. And it comes up in the curriculum over and over again in terms of content, who's paying, what are our insurance companies like, those kind of things. But I think engaging with it at a deeper level and trying to understand what motivates not only our healthcare system, but also systems around the world that we could at any point either see our system change into or go perform in systems like that themselves. It's just so important to understand how the greater structure of healthcare influences the decisions that we'll make every day.
Right. I like how you're highlighting there's this system that we're working in that something's like I think about it as like the fish that's in the water. It doesn't know what water is necessarily, or for us walking through the air that we breathe, and maybe some of us don't think about that as much. But I really like the way you talk about continuously re-examine that. And so I'm curious, maybe we can all kind of put a tack in that, and we can kind of come back to explore that a little bit further as we go through. Um, maybe Audrey, I could start off with you, and I know you're a first year medical student, so you're just kind of getting started with this global surgery selective. Are there some of the fundamentals of healthcare systems that so far to you have kind of declared themselves in your mind?
Yeah, that's an interesting question. Like you said, I'm first year, and so we've just started to scratch the surface of the very complex and large topic of healthcare systems. Um, but for me, I think about it in the case of how is it affecting the patients. And so I know it's a big system and I know it's a lot of moving pieces, but as doctors, I do think that we have some small role and we can in some ways influence how the system is going to affect the patients and the people that we're interacting with. And so that's kind of the biggest thing I've started to hone in on so far is yes, it's a big system and it's very complicated, but it does affect real people in real ways. And it's important that we try to make it as best that we possibly can with what power we do have in the system.
Youssef, I wonder if you can kind of build on Audrey there, kind of thinking about this patience. And I think I like the way she's highlighting you have this complexity, and in order to kind of get our arms around it, sometimes we have to simplify something. But there is this kind of tension, this back and forth. Your second year, you've kind of been with this longitudinal selective for a year. How have you seen some of these fundamentals come forward?
Yeah, I think, like Audrey was saying, the system is very, very complex. And we've learned a lot about it through the selective, through our curriculum. But even then, I think I don't fully understand it yet. And I don't think I will until I'm practicing and dealing with it every day. I can already see, in the patients that we do see, how the system affects them. And I think even as a patient myself, how the system is super complicated, with insurance companies and everything that, as that patient has to deal with. I think as physicians, future physicians, learning about the system as best as we can and trying to incorporate that into our practice, I think if the patients have to deal with it on a daily basis, we should also learn how to, work within the system to make their lives as easy as possible. And I think this is particularly important with patients who kind of are more underrepresented, and they kind of, with some patients who have a more difficult time with the healthcare system. I think it's obviously a much bigger system than all of us, but I think, like Audrey was saying, to work within our means to make it easier for them specifically too.
And Richard, can I ask you, so Yusuf brought up this idea of, what we're learning in the curriculum versus the selective that you guys have elected. How do you contrast those two? How has the selective enabled you to kind of explore how you think about healthcare systems further?
Yeah, I think it is important also when considering perspective of what a system is and what it's designed for. I mean, systems really guide like the conversation on both macro and micro levels. I think that's becoming increasingly more true as we're connected, more globally, as well as with the further division of labor. In the past, a lot of the practice was sort of, family, physician oriented, but specialization, while it allows us to expand ourselves more expand what's possible in healthcare. Um, we're also missing a lot of the insights that we're able to really gain on a systems level. And I think it's really important when considering this in the context of inequalities in the healthcare system and how the division of labor sort of upholds a lot of those inequalities. For example, in many healthcare systems, the experience of billing a patient is separated from the practice, which acts sort of to shield or as a barrier separation from having that person-to-person interaction of what is, in many cases, for example, like life-changing bills.
Hmm. That makes me wonder, Audrey, if I could ask you, and I realize I maybe put you a little bit on the spot, but eh, does it surprise you as a medical student, that, this kind of, Rick's pointing out, thinking about all these different levels and thinking about how billing works? I don't know if you were an economics major before coming to medical school or worked in those ways, but I imagine a lot of people maybe come to medical school kind of focused on learning the medicine and science and I guess my question is, are you surprised about this focus on learning about like or thinking about how does billing work, these other components of the healthcare system?
Yeah, I was not an economics major, but that's a super good question. I, like you said, I come into medical school, and I think a lot of people come into medical school thinking about science and research and the lab, and it's very removed from the billing and the real world impacts on people. And as Rick said, that can be kind of a bad thing in a sense, that people forget that that's happening, and they can just start racking up the bills and the tests and the lab orders without considering what it's actually going to cost the patient at the end of the day. So I don't think I'm necessarily surprised, but it is something that we don't talk about very often in school. At least to my understanding, as a first year, we haven't talked about it yet. And so it's not surprising, but it's a little bit disappointing, or a little bit disheartening, I should say, that this is something that's a reality and we have to deal with it. And it's very hard to learn, it's very hard to understand, and it's something that's bigger than most of us. So it's something also that's difficult to deal with and difficult to realize that's the case for a lot of patients.
Yeah, I like the way you put that. I think there is something about, an element of how much do we have to know so that we can function in our healthcare systems, or we can kind of optimize our healthcare systems. But like you're, I think, highlighting, there are other colleagues that are like playing these roles as their primary. Uh, what do people think about kind of how we strike that balance of kind of how much do we focus on this in medical school? How do we get each other to be able to kind of talk the financial language with colleagues? Or you brought up other elements of kind of the healthcare delivery. How do we work to interact with colleagues who are maybe not physicians, maybe nursing colleagues, allied health, the C-suite?
I'll start on it just because I left off. But
Yeah.
it's tough because medical school and medical training is a finite period of time. And although training is very long, it still has to be completed within an X amount of years, and you still have to have a finish line. And so it's hard to cram more and more skills and knowledge and, information into that period of time. So I think that's a tough question. I think there's more emphasis and more learning that could definitely be done in medical schools, or, on your own free time, as that's something that's important for you to learn as a human being. But I'd be interested to see what other people had to say about that.
I've found similarly that maintaining curiosity is something that has driven me to explore these complicated areas of the medical field, and kind of learning humbly from the amazing people here at Mayo who specialize in all sorts of things, from patient advocacy to billing to insurance coverage. They play such a crucial role, and I think are really underrecognized in our system. And the experiences that I've had, either working with them in a clinical setting, sitting down and hearing them speak at events, conferences, or even listening in on podcasts like this one, they've opened my eyes to the work that they do and given me just a little bit of taste of how I can fit into what they're doing as a physician and try to make this kind of janky healthcare system that we've created run a little bit more smoothly.
You know, I really like the way you put that, Matt. I want to put a pin in that about curiosity and come back to that in a little bit. And I want to kind of highlight what Audrey was saying about kind of this curriculum and medical school being a finite time, because that hits me right in the medical educator's heart of, right, we're trying to build a curriculum and set of experiences to build competency, hopefully excellence in our physicians. But I think it does acknowledge the reality that there are limitations, which I think kind of fosters some creativity. But maybe if I can bend over and ask Yusuf, you know, how are you finding opportunities to think about exploring healthcare systems so far in medical school?
Yeah, so I think kind of like what Matt was saying, I think exploring other options as well, in addition to the curriculum, like podcasts, books, stuff like that, I think helps to kind of give a more comprehensive view of things. And I think even within the curriculum, the things that are well established, the things that everyone has to go to, and it is really important to go to, are those kind of healthcare system science classes. But then, you can add on additional electives like what we did with the global surgery selective. And I think the more you realize how important it is to learn these things, I think it just gives you that added motivation to actually, in your free time, even if you're tired from, learning about all the medicine and science all day, and it's exhausting, and it can hurt your brain sometimes. But I think it's important to, like Matt was saying, maintain that curiosity and that drive to learn the stuff outside of the science, to kind of give yourself a more comprehensive worldview.
Right on. Are there other opportunities that people have kind of come across in medical school so far?
I think this can be a situation where our patients are some of our best educators, maybe more than, especially a lot of us who are just younger in medical school. They've had experiences navigating the healthcare system with different insurance companies, different providers at different institutions. And hearing out their stories is something that can give us a lot of really valuable perspective. I also think working through patient cases can be really helpful. Rick and I were on a team recently at a free clinic here in Rochester, and we had a patient come in feeling generally unwell, and it turns out he was a young man and he had an ejection fraction of 26 due to a unknown cardiomyopathy. And the textbook answer is to check some labs, get him on appropriate heart failure medications. But our options were different in this setting. We're at a free clinic, we have an uninsured patient, and now we're working to try and understand how can we best work within the constraints of the free clinic and our limited resources to help this patient and ensure their safety, while also not just sending them to the ER and causing catastrophic financial loss. So learning from this patient's case and their experience is something that can really help heighten our own knowledge of the world that we're operating in.
I love that example, right? One, because it's specific, but then two, because I think this gets at something for all of our listeners, right? Who probably a minority of them are going to be medical students, but hopefully we had a couple. But who can be thinking about this podcast and how what might I take away from this, right? And one of the things is sometimes we listen to podcasts with people in the ivory towers and such like this, but what we're talking about today about thinking about healthcare systems is really thinking about what we can make the most with what we have. And Matt, can I ask you to kind of maybe elaborate a little bit about were there how did how did you approach that, right? Because I imagine there's a temptation of, well, if we had other resources, I would do this. But how did you kind of approach doing the best with what you had?
Yeah, I mean, it was a complicated situation with it, something that kind of took all of the brains of the team that was there, thinking about how we could work through this patient's case. We were digging up former labs. People were calling previous healthcare providers, trying to figure out what kind of myopathy we're looking at here. We're considering, is this patient clinically too sick to not go to the ER? Do we need to send him? We're calling other resources through Mayo Clinic Charity Care, looking at can we get him an urgent cardiology visit, but also just recognizing that we can't just give him the medication off of our little limited formulary sheet and hope that it works and tell him to either come back in or go to the ER if he's feeling sick. Like these options that may be available to some people who are better resourced were kind of off the table for us. And it really just required a lot of collaboration and phone calls and trying to figure out how could this patient's needs best be served with what we had to offer in the setting.
And I think you said Richard was with you on this case, right? And maybe I can ask Richard, can you maybe elaborate on of seeing the team come together, and were there elements that you saw that were kind of this worked well, and or are there elements that you saw with the team coming together that was maybe counterproductive? I just want to kind of call highlight to those elements.
Yeah. So I think I was a little less involved in this case. There's actually another instance that same day where a patient was coming in for just a medication refill, and on exam we found a murmur, and then looking back multiple years, we found that they were found to have severe aortic stenosis that was never then followed up on. So that was basically a similar situation. So I can speak on my experience with that.
That'd be
Um,
fantastic. Yeah.
yeah, so I think one of the um, major things that we identified was, why didn't they follow up, as well as um, kind of following the impact that communication really has, like on medical care, especially with like say immigrant populations, because the patient was a non-native English speaker, and they really did not seem to understand what the pathology was, as well as like the needs for it to be followed up on. And after we were able to explain really and make sure that they understood what was going on, then they were, I'd say, amiable to just following up with the issue to make sure that nothing bad happens down the line, hopefully. So I think in a lot of instances, especially again with the subspecialization, where we're all kind of confined to our little boxes, and we're hyper focusing on efficiency and getting things done quickly, we don't take a step back and make sure that say does the patient understand what's going on, and I think that taking a pause and a step back in this hasn't really helped everybody involved, even though I mean, this is a time-consuming process. Like Matt said, it took a lot of everyone's brains to come together for, one individual. And I think in a system that, really prioritizes efficiency and getting things done quickly, I don't know if that is as, able to be done. So I think that is a pretty big impact.
I'm really glad you highlighted the kind of pausing or slowing down deliberately. That's something that particularly I've read about this in the surgery literature when it comes to competence about, you know, um, experts realizing here's a critical point, and so as a result, like I need to slow down, I need to focus instead of just this is going along and I'm finishing out the procedure. Maybe I can ask Audrey, since we were talking about this, element of building expertise. Is that something that you've kind of started, that you've kind of been exposed to, this kind of slowing down during a critical phase? Is that something that you've seen in your first year already, or is that something that you haven't come across yet?
I'll say I haven't come across it in technical practice too much, but it's interesting that you say that because they tell us, at least they've told us several times, that as medical students, we actually have more time than the attendings and the consultants and everybody else. And so for us, it's very important to slow down and maybe be that one person that sits in the room, talks to the patient, listens to their story, hears what they have to say. And if something comes up, we can bring that back to the consultant and say, hey, they probably never told you this, but I just had a conversation and they brought up a really interesting side point that I think is important here. And so I think the doctors I've been around and worked with, they understand the importance of slowing down and they do absolutely try their best to slow down. But like Rick said, there's pressures, there's outside factors that contribute to that. And sometimes it's just hard or it's just a little bit too overwhelming. There's too much going on and it just doesn't cross somebody's mind. But as a medical student, they have harped on us. It's important to learn that. And hopefully if we do take the time to learn to slow down, that can carry forward to when we're the consultants and we're the attendings, and we can really put that into practice, hopefully, in the future.
Uh, it makes my medical educator heart go pitter patter that you're hearing this already in the first year, and this is being encouraged. Youssef, can I ask you? You're a second year. Have you seen this play out? And I'm wondering if you can kind of specifically kind of highlight some of that tension between getting the work done but slowing down. How have you seen this navigated?
Yeah, I think in terms of taking that pause and taking a time out, I think I've mainly seen it, kind of a more explicit timeout in the surgical setting, like you were mentioning. But just in terms of patient care, in the positions that I've been in so far, it's mainly just been coming in, getting a quick history and physical, and going back and speaking to the consultant. But I think I started off very anxious about that and wanting to make sure that I got it done in a timely manner. And I found that when I was doing that, I was not doing it well. And so I think I think when I started having, first of all, a checklist when I go in, a checklist of things that I want to ask about, and making sure that I take my time with the patient and listen more than I am just hammering out questions at them. I've noticed that I end up getting a much better history from them. And so I think kind of keeping that either checklist in your mind or checklist with you in front of you when you go in to speak to them, I think is super important. And I think that's something that I really appreciate about being at Mayo is they teach us the importance of being present with your patient, because those things that I told you that ended up helping, those aren't things that I came up with. Those are things that my consultants told me that I need to get better at. And when I did incorporate those, I found, first of all, a much more coherent and much more cohesive relationship between me and my patients.
I want to kind of go back to this idea that was kind of said earlier in our recording here about this idea of continuously revisiting how we think about healthcare systems. I know we've kind of been really kind of focusing in on specific examples. I wonder if we can kind of pull back and, how have we? I'm going to ask this to maybe go a little bit metacognitive and think about how we're learning stuff. But this is really kind of an open, maybe a junk ball question. I'm going to put it up there and set it out. But how do you approach continuously revisiting something, right? So if we think about medical school as this kind of spiraling curriculum where we're kind of getting exposed to things and re-getting exposed to things, but because of our training we've had in the interim, we can go deeper. How do you guys approach capturing that learning so that you are meaningfully revisiting this each time?
I personally, we have I'd say a class that's called Senior Sages, where we meet with a retired medical doctor, and in general, they help give us like life advice for you know what they found helpful during their experience as a physician. And my sage recommended me to keep a notebook and write down, just like things that I've done throughout the day, things to help with like memory. And I think that it's very helpful to help, write down important learning points just to, have it down. And then maybe, once in a while, I like to go back and read through my notebook. And it also helps with just like remembering funny moments that I might have forgotten about. Um,
Well, spot on. I think that's a wonderful technique. Do others have other ways that they're capturing their learning?
I think for me, I think being in medical school, I've realized that, learning the science and the medicine and everything is very important. But I think something that's even more important potentially that they're teaching us is how to think about things and how to research things that we get interested in. So I think having that context and learning if I find something that I feel is particularly important, how to do a deep dive and figure out everything about it and figure out what is important about it. I think just kind of that uh, high level thinking, I think, is something that I really appreciate that I feel that I'm gaining from medical school. Um, yeah, I think that's something that I would say I use to learn more.
Um, a little bit different. And of course, I haven't had as much experience as the other people here, but when someone gives me feedback or maybe something I didn't feel great about, I usually remember that or jot it down or something. And then I really try to find as many opportunities to practice and relearn and use that skill as I can. So every free clinic, I go and volunteer. Every opportunity to work with my family on something, I use that. Every opportunity to go to a free suture clinic at the school, I use that. So I just really try to re-practice that skill over and over and over again, and just utilize the opportunities that are already right in front of me to really exploit those skills and make sure I'm learning it over and over again, even if I feel okay about it.
Yeah, and I think our patients can be our best reminders to take those deep dives, like Yusuf was saying, and just remain curious. And when they have a barrier to taking a medication, or they're trying to figure out what insurance plan is going to maybe work better with their new diagnosis, taking those cases and instead of just letting it be oh, that's interesting, or oh, I wonder, taking the time to resist the urge to only study testable material and really letting curiosity drive you into that deep dive of, hey, I'm going to go back to the workroom and do some research on what kind of plans would be best for you and your situation right now. Or, hey, I don't know a lot about how we can get that medication covered, but I think this would be a great opportunity for me to learn. it's those moments and those interactions that I think are most frequently brought about by our own patients that we can really use as a platform to dive deep and learn well.
Okay, it's official. I think I want to recruit all four of you to become pathologists. The idea, the way you guys are going about capturing your learning, the way you're talking about, it sounds like you guys are all internally motivated. You've got the curiosity, the fire, and you're looking to just get the repetitions and practice variations on a theme. So these are all elements, right, that our listeners can really take away from this podcast, right? If you're a physician in practice, that listening to these medical students might be sparking in your mind to think about some of these kind of adjacent areas of your practice that you may not be taking a deep dive into, but certainly is the water that we're swimming in. The healthcare system that you work in. If you're a laboratory professional, you could be thinking about how am I interacting with physicians and helping them understand, how they can optimally use the lab in whatever kind of resource and situation that you find yourself. And students, if you're listening to this, I think there's some great tactics and strategies that these medical students are really articulating. That I just want to call your attention to this idea of writing things down, reflecting on things, and practicing the heck out of it are all fantastic strategies. Um, can I ask you how, like, medical school is a challenge? I imagine sometimes you're tired. I don't know, maybe you guys have like, some battery inside you that is just like amazing, but how do you maintain that curiosity when it's tough?
For me, it is hard sometimes and the motivation dwindles, but I, similar to the previous question, circle back to things that I really enjoy and I really like. And I was like, this is tough. This maybe not my favorite thing at the moment, but can I apply that to an area that I really love and I'm really passionate about? For me, that's really serving underinsured, underserved patients. So if I'm learning about pharmacology and I'm drudging along, learning about 100 drugs a week, and it's tough. It's not the funnest thing for me personally. But can I apply that to my patients that I'm going to see in the free clinic? And this is a really important medication for them. I need to understand this. I need to know this. So it's important for me to learn. And kind of remembering that in the back of my head does help motivate me, even when I'm tired, even when I'm, late at night and just wanting to go to bed.
Reconnecting with your why is what I'm hearing. That's very powerful. Yusuf, were you gonna hop in?
Yeah, I hate to be repetitive, but I think that's exactly my answer. A couple of things. I think being in the preclinical phase of your studies is it can be particularly demoralizing sometimes, just because you're constantly your head's in I was gonna say your head's in the books, but I haven't opened a textbook this entire time. But I head more in the laptop, I will say. But you're just learning the science behind things and the medicine behind things, and it's hard to see how it applies to real life sometimes. And I think having little exposures here and there as to how it can help patients, and particularly patients who need it the most, I think is very, very helpful. And for me personally, my family is Egyptian, so they immigrated here a while ago, and I go back to Egypt constantly, and so I have exposure to what's available there, and kind of the stark difference in what some people have access to. And so I think having that kind of drive to help, people back home or people even in America who have similar experiences, I think that's a big thing that can keep me going when the going gets tough, honestly.
I really like the way I think your response, Yusuf, actually does build on Audrey's, right? I mean, while it is both, both of you are saying you're connecting to your why. I think you're like highlighting the pluricity of just how diverse that why may be, and I think that's something that I'm going to be taking away from this conversation with you guys today. Is kind of because I know for myself sometimes when I'm on service and at the end of the day I would just want to go crash on my couch, but I know I still need to crack open and, the latest publication that came out. I need to be aware of what those papers are. Okay, I want to do the thing that I said at the outset that I wasn't going to do. That's to ask a question, just go down the line. But I just want to kind of take our listeners out by having each of you share, what advice do you have for our listeners who would like to further develop their abilities, their skills, to think about healthcare systems, because some of our listeners may not have really deliberately thought about this in a while. Some of our listeners may not necessarily be thinking in these terms, or just be starting to. So what advice do you have for them? And I guess I'll thank you as we're kind of going out and start with Matt Gish.
Yeah, thanks again for having me, Dr. Kreuter. This has been a ton of fun. I think my biggest piece of advice, and something that I'm still working on daily, is to continue to chase curiosity. When a patient presents with a socioeconomic challenge, or you're having trouble navigating the system that you're providing healthcare within, taking a step back and trying to identify where that confusion is coming from. And even if you have a test coming up on the radar, or you've just got other emails and research projects to focus on, being able to chase down that curiosity and listen to a podcast, flag a couple articles, pick up a book maybe that challenges the way you currently think about the healthcare system. Those are the things that, coming back to our why, I truly believe will help make me the best provider I can be someday. And at times it's really hard to understand the value of chasing down curiosity as opposed to doing more flashcards and more practice questions. But taking a step back and understanding, who do I want to become and how do I get there? I think taking those learning opportunities is always the way that will help me push forward and become the best that I can be.
Thanks so much for sharing, Matt. Audrey Banks.
Yeah, I think probably everything I'm about to say has been said in one way or another, but for me, asking questions is a huge one. If you don't know something, you don't understand something, just ask the question. Usually people have a lot of information and background knowledge that you don't have, and it's really valuable just to let them share that with you. The second one, for me, I really like to engage with people who aren't typically doctors, or maybe not in the same realm as us. So if you can reach out to people who know a heck of a lot more about health system sciences than you do yourself, that is going to be so hugely helpful, and just gets you outside of your bubble, helps you see things from a different perspective, which I really value when I'm learning anything. And then the third one is, if you have the time and the energy, use your own personal time to do some Googling, look up a cool video, look up a cool article. It doesn't have to be a lot, but if you just kind of get the itch to learn something, just read a quick paper. And I think that if you do that every once in a while, you'll still learn a lot. And I think that's really powerful to do.
Thank you, Audrey. Yusuf Khalil.
Yeah, thank you so much for having me again, Dr. Kreuter. I think for me, my big takeaway would be to think about the contexts that your patient presents in, or comes from. I think we in the medical field have a lot to learn from people in the field of public health and epidemiology and health system science. And I'm biased because my wife does study public health, but I think we do have a lot to learn from it. And I think learning about social determinants of health, and learning about kind of the conditions that lead to conditions that patients present with. And so I think we have a lot to learn from the field of public health, and to incorporate that into a more holistic worldview of the field of medicine.
Thank you, Yusuf. And Richard Betancourt.
All right. Yeah. So I mean, there is I think for me, there's a lot of talk about examining or taking out bias, or in the context of global health, taking out Western perspectives when it comes to healthcare. And I think this follows the same issue when it comes to the idea of, say, like color blindness when looking at racism, where it ignores the fact that we live in systems where these biases are ubiquitous to a certain extent, whether consciously or unconsciously. And one teaching point that I remember from class is, there's this idea where physicians are meant to be these stoic beings that are objective and operate only in the confines of science. But I mean, physicians are humans. So whenever you have, say, a gut reaction towards something in clinic or have an emotional response, I think it's really important to just examine that and explore why. And just like Matt said, being curious.
Those are awesome responses. Thank you all for sharing your advice and talking with us today. I think this has been really impactful for me to think about. I haven't been deliberate about thinking about our healthcare system for some time. And thank you to our listeners for joining us today. We invite you to share your thoughts and suggestions via email to mcleducation@mayo.edu. If you've enjoyed this podcast, please subscribe. And until our next rounds together, we encourage you to continue to connect lab medicine and the clinical practice through educational conversations.